If you've ever experienced cavities, the chances are that you've experienced the dental filling. Fillings with dental material are used for repairing dental damage caused through tooth decay or injury. There are many different kinds of dental fillings that are available, every one with each having its own advantages and disadvantages. In this clip, we'll go over the different varieties of dental fillings available as well as discuss the benefits and drawbacks of each. 1. Composite fillings. Composite fillings are the combination of glass and plastic. They're tooth-colored and make an excellent selection for fillings that are noticeable areas in the mouth. The composite fillings are bonded directly to your tooth, creating a sturdy and long-lasting replacement. They're also less invasive as compared to other kinds of fillings since they don't require the extraction of tooth structure that is healthy. A disadvantage of composite fillings is they're more vulnerable to wear and staining compared to different types of fillings. Also, they be more expensive than amalgam fillings. This may be deterrent to certain patients. 2. Amalgam fillings. Amalgam fillings comprise the amalgamation of various metals comprising mercury, silver, copper, and tin. These fillings have been utilized since the beginning of time and are well known for their toughness and long-lasting properties. The cost of amalgam fillings is also low, which makes them an attractive selection for patients with the tightest budget. A disadvantage of amalgam fillings is the silver hue, which may not be appealing to certain patients, particularly around the noticeable areas in the mouth. There's also been certain concerns regarding the use of mercury-based amalgam fillings, but research has confirmed that the mercury level in these fillings are very low and does not pose a threat to the health of patients. 3. Gold fillings. Gold fillings consist of the combination of gold and different metals such as copper and silver. They're renowned for their long-lasting durability and can last up to 20 years and even longer. Gold fillings can also be considered biocompatible. That means that they are in good advisability to the body and won't cause allergic reactions. A drawback of fillings made from gold is the price, since they're typically the most costly option in dental fillings. Additionally, they need multiple appointments before they can be placed because they're created at a dental lab prior to bonding onto the tooth. 4. Ceramic fillings. Ceramic fillings are also referred to as porcelain fillings, are composed of tooth-colored ceramic materials. They're extremely aesthetic as they blend in with your natural tooth. Ceramic fillings are resistant to wear and staining, providing a durable option in dental crowns. One disadvantage of using ceramic fillings is that they are expensive because they are known to cost more as compared to composite fillings. They also are more vulnerable to cracking or chipping over other kinds of fillings. As such, they could not be appropriate for people who grind their teeth or use clenching techniques. 5. Glass ionomer fillings. Glass ionomer fillings are made of a mixture of glass, acrylic, and fluoroaluminosilicate. They're tooth-colored and release fluoride. This helps to safeguard the tooth against the possibility of further tooth decay. The fillings in glass ionomer are fairly inexpensive and straightforward to apply, making the ideal option for both adults and children suffering from cavities outside of the load-bearing areas in the mouth. One disadvantage of glass ionomer-based fillings is their low durability, as they are prone to wearing down more quickly than other fillings. They are also more likely to crack and might need replacement earlier as other fillings. In the end, there are various types of dental fillings that are available, and each having its own advantages and disadvantages. The ideal choice for your needs depends on your specific desires and needs, along with the position and size of the tooth. You should examine the alternatives with your dentist so that you can find the best method for you to maintain your dental well-being.